The Care of the Critically Ill Surgical Patient course, the CCrISP course, is a 2-day practical course designed to teach surgeons in training in all disciplines of surgery the fundamentals of how to look after their unwell patients, assess and handle the ill patient, and then it builds on that framework by adding in core knowledge.
Okay, let's see how he gets on.
Okay, and just want to do a quick neurological assessment.
The core aspects of the course are to teach the surgeon in training how to look after practically unwell patients. So we start off with a systematic approach to the ill patient, so that whenever they go to see an ill patient, whether on their ward or in unfamiliar circumstances where obviously they're under more pressure, they have an almost automatic response to how they begin to assess that patient. Junior surgeons, again, from having watched them for a number of years, are very good at doing what's within their comfort zone. If you pressurise them, as they are in real life, when they're on call, particularly out of hours, or when they're in unfamiliar surroundings or with unfamiliar patients, they're not so good at handling that. So we put them under a degree of clinical stress, both in assessing simulated patients, working with actors, case scenarios through the course that are designed to recreate really the clinical pressure that they do feel when they're on call or when they're doing their ward work.
I think the CCrISP course is special because it focuses on something different than the other courses focus on. Basic skills focuses on the practical skills of suturing and plastering and laparoscopic surgery, EMST on the principles of trauma. But CCrISP focus really on the day-to-day activities of a surgical registrar and a junior house officer that is working on the wards, dealing with difficult patients and patients who may have undergone complications following their surgery. Skills. Now, have any of you ever had any formal training in communicating or developing communication skills? The other aspect I think is very important about CCrISP is it provides a basic standard of communication skills for our basic surgical trainees, and it's really the first opportunity they have often discuss common problems that can occur in the wards in a fairly structured way. And the basic theme of CCrISP is so important. It gives them a structured approach to managing those sick patients. That immediate assessment and then the definitive assessment, following through to establishing whether the patient's stable or unstable, and then following that through to the definitive treatment. So it gives them a good structure to work on.
Thanks very much. It's been a good fun 2.5 days. We've had a lot of fun, I think. It's made learning fun, and I think making learning fun makes it very, very practical and makes it much easier to learn. And I think this course has been one of the most practical courses I've been on, and also one of the most valuable for the people that it's aiming at, who are the first year surgical trainees. So I think its great benefit is that it teaches a very simple, very effective system of dealing with just about any unstable, critically ill patient to people who may not see that many and may not know how to deal with them otherwise, certainly until they've done ICU terms, for instance.
Okay, what blood tests would you like?
Let's do a quick full blood count. And can we do a bedside BSL right now, because he's unresponsive?
One of the strengths of the course is the skill stations, particularly where trainees can learn techniques such as central venous line insertion, the understanding of pressure waveforms, arterial lines, some of the intricacies of pulmonary artery catheters used to measure cardiac output.
And now when you translate.
One of the very important skills that is being developed and pursued in this course is that of communication skills. This is thought to be so important for every doctor that 2 whole skill sessions are devoted to communication, both the format of communication, the different types of communication, and the students get to perform in role plays which really put them right in the hot seat.
It would involve
having to amputate part of that leg.
No way! What do you think I'm going to do with half a leg, for God's sake? You people are unbelievable. I've been in hospital so many times for so long, and at the end you just want to cut off half my leg. What have you been doing for all these years? This is medieval, people chopping off part of people's limbs.
Well, apparently some of them find me a bit scary, but the brief in some situations is for me to be difficult, because say I might be in a situation where I've just been told that my daughter has died, or I might be someone who's got alcoholic withdrawal, so is very confused and quite angry, or someone who's just been told their leg's about to be amputated. So they're purposely difficult situations, and I play up to that. But I think that the idea behind that is that the doctors themselves are possibly going to be dealing with people who are vulnerable, emotional, and that they're going to have to deal with that.
Well, hopefully the standard of care on the surgical wards will improve as a result of this course. I think there's growing evidence in the literature that the standard of care on surgical and medical wards has deteriorated over the years. And there are a number of reasons for this. I think that we're asking junior staff to look after increasing numbers of more severely ill patients. They're more aged, more of them are coming in as an emergency, and of course the training programs are much shorter nowadays, so the depth of experience that doctors have to manage difficult problems on the ward is less than it was some years ago. More patients are being admitted to high dependency units and to intensive care units, and so what we're keen to teach is how the care of the critically ill surgical patient fits into the continuum of care, which may include ward care, high dependency unit care and intensive care.
Okay, let's hold it there. No, I think you did well. I think the primary school was pretty good. I mean, and you did indicate that you were going to put an IV in, and we somewhat distracted you with questioning, and you were going to run some fluid, and that is good. If you're in doubt, get access. If you don't know what's going on, because if something else happens, you may need that IV access promptly. If you're in doubt, give some fluid, but check, see what the fluid volume is.
There's a system for you to use that keeps you going when you don't know what's going on, as you demonstrated very well. You kept the system going very well indeed, and the way you buy yourself time is to go through, check back. Yeah, happy with A, yeah, happy with B, yeah, circulation's coming on. D, still not sure, whatever it is. But you use the system to help keep you on the rails.
I do recommend this course not only to basic surgical trainees, I recommend it to medical trainees. Although the course is called critically ill surgical patients, it has a lot of medical problems that we have to deal with. Also recommend it to emergency people, trainees in emergency, and intensivist, training in ICU and HDU. So it is a recommended course, yeah. I have learned a great deal from it.